Lori Lightfoot says the city is ready to distribute its doses of the vaccine beginning in hospitals possibly as soon as tomorrow. But she says there are still significant hurdles in the long struggle against COVID-19.
We are also ready to distribute the vaccines.
Chicago area hospitals are preparing to receive doses of the vaccine, with Loyola University Medical Center and Christ Medical Center as two of the state's 10 regional distribution points. Initially, the state of Illinois will receive a total of 109,000 doses. 23,000 of those will go to the city of Chicago. The other 86,000 will go to the rest of the state.
We spent literally months building up the infrastructure, working with our hospitals, building out cold storage, a capacity.
Today, during a national television appearance on MSNBC, Mayor Lori Lightfoot discussed the equitable distribution of the vaccine.
Make sure you capture the demographic information on who's actually getting the vaccine. If you do that, you can ensure that there's actual equity.
She says the city faces two major challenges in the vaccination effort: distribution and distrust.
We've got to communicate effectively to them about the virus and why it's important, but also why it's effective. And the best way to do that is with trusted community leaders.
We're going to listen to exactly what the community is saying and try to get them to the answers.
The Reverend Robin Hood says faith leaders will play a major role in combating community skepticism.
We are not the ones that are going to say, take the vaccine. We are the ones to say, let's get all the information that we can gather and make an educated decision about this.
In Auburn Gresham on the city's south side, he helped organize a drive-through and walk-up testing event. Leaders there say testing and masks remain essential.
The notion that the vaccine is here, that's great. But until it hit us, until it goes into our arm, until we're convinced that it works, let's do what we can do, wear a mask.
City authorities say all 34 hospitals in Chicago will receive doses, but no hospital will get more than 2,000 initially. But the city is expected to receive about 100,000 more by the end of the year.
The need to have a different approach with testing and tracing.
In Little Village today, aldermen criticized the city's plan, saying communities hard hit by the virus on the south and the west sides should be near the front of the line.
We are urging the Chicago Public Health Department that we need to change our approach as we are talking about the vaccine.
And right now, the first people who will receive the vaccine are healthcare workers who are actually treating COVID-19 patients, then the most at-risk people, then first responders and other essential workers, and then the wider public, a process that could take many months. Reporting live tonight outside of City Hall in downtown Chicago, Mike Lowe, WGN News.